So, and if you want to run investigation to check that out, is fine. But I can confidently tell you that somehow you will have defecated that substance. Funny enough, I equally, as a small boy those days, I've swallowed all those coin of those days before. I don't even know the particular, whether CC or something. All those small, small coin that we spent those days. I've swallowed it before and I defecated. I saw it when I defecated it. So that's what uh, we say children are fun, you understand? So I remember my own history of that, and I know that. So, and from my knowledge of anatomy, from your mouth to your anus, it's that's why when you eat, body will take the one that is useful and defecates what is not useful. So, it's not likely going to be a problem. But if there is anything to say about that, I can confidently tell you that you don't need to worry yourself. But 30 years. See, if there is going to be any problem, you are going to not defecate. If it's going to block something somewhere, you will have been I mean, we will have presented in the hospital because there are some narrow parts of the tubes. There is something we call ileocecal junction. So that's like a valve area in your intestine. So it's a narrow part. So for that place not to have been blocked following the time you swallow that thing, and for you not to have been brought to be, I mean, taken to the hospital as emergency, that has been taken care of. So I don't have any doubt about the fact that you are fine. So it shouldn't be a worry. But if you
Okay,
want to
thank you, sir.
investigate it, it's fine. If you want to investigate it, it's fine. But
Thank
it's
you,
a
doctor. Thank you. You have
yes.
answered the questions. I have a lot of people that want to ask you questions. I will just welcome only more two. Then, Mrs. Alaba, I will send your question to doctor and you will get back to me. I will get back to you. So I want us to allow people that have not asked any question to answer them. I believe you have, doctor, you have read the question that I sent to you. I
I
don't,
checked. I checked. I've not seen, sir. Let me check again, sir.
okay, maybe I should read it from here. He said, thank
It's
you,
fine, sir.
doctor, for the teaching. Is pap smear, I don't know, maybe it's a medical term. Is pap smear necessary for a woman who married as a virgin, now in monogamous marriage with a faithful partner? Shall I read it again?
Yes, sir. The pap smear?
Okay, is pap smear, pap
Yes, sir.
smear,
Yes, sir.
Papsmear,
Mm, mm.
necessary for a woman who married as a virgin, now in a monogamous marriage with a faithful partner?
Yes, it's for every woman. It's not a question of being faithful in marriage or not. Yes, people that have multiple sexual partner may be more at risk, but as far as you are engaged in sexual intercourse, everybody is to check themselves. It's not a question of faithfulness alone. And it's not that your husband is, we just know that HPV is contracted from sexual, intercourse. So a woman should check herself if she's sexually active. So that's the rule about that. So it's not a tell that your husband is not faithful. Somehow HPV is gotten from intercourse. So and how and why we really can't. But like I said, it's commoner with people who go from one partner to the other. So, but you are not likely going to have any problem. Just check yourself. Majority of people don't have problem, but the few that will have problem, so that we treat them on time and they don't go with cancer that can be prevented. So that's why we do it.
Hey, thank you. God bless you. Shegun, quickly ask your question now. Brethren, please, let's give like 10 minutes more before and then we are done. Please, this is very important. We are sorry for taking more time, more than the schedule.
I'm very fine, sir. I'm
Okay,
very fine.
so sorry. Okay. Okay, Shegun, go ahead. You raise your hand. Okay, while we wait for Shegun, Pastor Emma, you can go ahead with your question now.
Thank you, Pastor. Good day. Doctor, I also greet
Good
you.
day, sir. Yes, sir. Yes, sir.
Yeah. Some time ago, I had a test and they said I am infected with a stone. Stone, I don't know what stone means, whether kidney stone or whatever. So, and they asked me to take some medications, which I did. But I want to really verify what does that mean and what is the implication? Because since then I've been having unrest in my mind. So because I'm not feeling any pain anywhere, I touch all my body. There is no place that there is a swelling or any clamping or whatever. So what do I do, doctor? Thank you, sir.
Okay. Thank you very much for your question, sir. I would have loved to know which type of stone, because we have kidney stone, we have gallbladder stone, and that one is in the liver. So,
Uh,
can you?
between the hello, sir, are you with me? Hello, hello.
Now you can go ahead and explain.
Okay. Maybe within the kidney and liver. They didn't explain to me very well. In fact, the person that did the test, it wasn't. I was not satisfied. That's why I'm asking the question so that I can know what else to do.
How long ago was that, and what was your complaint that led to diagnosis of stone?
In fact, there was no complaint. There are some people that call themselves health workers and all that. Sometimes they will be passing by. They will tell you, do a checkup, do a test. They are carrying one kind of machine. So that is how the thing happened.
I'm smiling here, sir. So don't patronize them again.
Okay.
They will mess up things for you.
Okay.
Many of them don't know what they are doing, so they're just how to make quick money. So
Yeah.
don't see, since that time now you've been disturbed and you don't know which one you even have and
Yeah.
all that. Yeah, take time out at least once this year. Go and do a general checkup. Know the state of your health, not the people that go by the road and tell you to check or something. They don't know what they are doing. Somebody just made one machine somewhere, and it doesn't have tail or head or any basis. So they're just how to make money. So, but my advice for you, take time out in the next one here, go and do a comprehensive checkup and know the state of your health. So if there is anything found, you will treat it and you'll be fine. So take that fear out. It's not necessary. Those people are just out to make money.
Okay, sir.
Okay, thank you, Doctor. Shegun,
Yes, sir.
is it by mistake or you have questions? If there's no any question, then
I have a question, sir.
okay, go ahead quickly.
Good afternoon, doctor. Thank you for the
Good
enlightening
afternoon, sir.
session.
Yes, sir.
So please, I want you to speak to the issue of health insurance, particularly among church folks, Nigeria here. I've noticed recently spiking, because of the insecurity and some dangers that happen. People have some health crisis and they are coming to church, say, please help us raise money and other things like that. And these things could have been handled if there was some level of insurance on their health. Some of these people even pay people pay as low as 50, 70,000 naira per year to cover themselves and kids or dependents, as they are called. Is there something anti-faith or anti-God about insurance that people are not embracing it? Or why are people not really more informed about it? Should it be something that we should preach and talk to people about? That's my question, sir.
Okay. Thank you very much, sir. The matter of insurance, it's working in an organized system, like excuse me. It's working well in organized system like UK, US, Germany, and where they are, I mean, what do they call their own in UK now? NHS and all that. So because of the fact that they have rules in those places and people are accountable for what they do. So their insurance system is like you can call somebody to the book. You can tell someone that this fund, explain how you understand. But as it is, we are still praying and trusting God for Nigeria getting to where we are supposed to be. And while we are awaiting that and we keep praying, let's still know the weakness that we have. Our health insurance scheme is relatively working, but it's not working the way it's supposed to work. For example, if we have cases that we need to operate now, they are going to give you some materials that, for example, you know that when a surgeon wants to operate, the suture is going to use, as in the just like thread. Suture is, I mean, that thread that we use to sew is what we call suture. So the suture we are going to use is very, very important to us. And some of us are going to go for the best sutures because we know that if you don't tie a blood vessel very well and the thing slip or something, it can cause the death of the patient. So you are going to go for the best suture. Now, presently, NHIS will give you inferior suture, and they expect you to use it for the patient. You may be confined to use it, but you know that it's not the best system, to benefit the patient. Many other things. If I have a patient I want to operate now, there are some packs that are not reusable pack. You understand that you are using it for just that patient. Which best patient is what for that. Guys, they are going to use cloth that they wash and sterilize and use for many patients and things like that. So if I'm to have a relative that is going to undergo surgery, I'd rather prefer to use my money to buy those things and not have the same cloth that they want to keep using for plenty people and all that for surgery, that blood, you understand? But then, if you ask me, can that be done? Yes, it can be done. But which one is the best? It's best to use something that you use it for just one patient and throw away. Do you understand? So, but those are the conditions associated with NHIS. Do you understand? Presently in the country, because the money they are putting into it is very small. I'm not blaming NHIS. I'm only talking about the fact that the fund allocated to these things make a lot of managing this or managing that and all that. So it's best that if you have your money, this is your life. It's better you use your money and get the best, healthcare for yourself. However, for people who don't have much or who even don't even have anything and they can benefit from NHI, it's perfect. They can enjoy it. You understand? After all, they can't afford, all these ones I just talked about now. So we can tell them about it and all that. So then sometimes when you even have, in fact, majority of the people that are low income earners, they are not even under the NHIS. Do you understand? Because a pepper seller in the market, she's not under any covering of any, she's not working with any government parastatal that they will say they are putting him or her under NHIS platform. So when they come, they still come to spend their money in the hospital, like even the people that can, I mean, even though they can't afford so much. So they are the indigent that when they come to the hospital, they take, you have to use this, use that for them, and they don't have money. At the end of the day, they become liability for the hospital. Sometimes they tell them to go and come and be paying, the small. Sometimes they free some of them, but okay, no problem. Some people even come, humanitarian people even come to, some philanthropists come and say they want to pay for this, pay for that. But like where I'm working, it's is relatively for people that have like is a little bit above the average class people. Yeah, even though it's federal government hospital, but is and a very indigent cannot come here. You understand? Because many things that we use here, they can't afford it. However, some indigent come. What am I saying? I'm trying to say that what you have said, we can do campaign, but see, majority of people that are in that class, they are not even under any government work. You understand that they can benefit from that arrangement of NHIS. But even the NHIS thing that we have been talking about is poor on its own. You understand? Is poor. Is really not advisable. On its own. If you have what it takes, I would rather say look away from it. You understand? So when you have a particular thing and they want to give you drug, they will give you a low quality drug. You understand? And it's this same your life that we are talking about that you should take care of. You understand? So how will you go for one cheaper drug that you may need to keep using and you are not getting any effects? Do you understand? I'm sorry, I'm not trying to put NHIs in a bad book, but I'm trying to tell you based on experience what I've seen. You understand? So I think if that's we survive, sir.
Thank you so much, Doctor. And we are putting it to you as the President Association of Resident Doctors. Please help us to do the campaign about the